Hi, everyone, and welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and today I am joined by an absolute legend in the healthcare space, Jonathan Landsman. Now, Jonathan has been a leading expert in the health and fitness industry for over 35 years, and he is the creator of naturalhealth365.com. And this is literally one of the most popular natural health websites in the world. And it's revealing the very best information about natural health and science. Natural Health 365 offers a free newsletter, weekly podcasts, and much more. And you can find him at naturalhealth365programs.com. Jonathan, great to have you on the Gut Reset Summit today. We've got a lot to talk about, an amazing topic, but thanks for being here.
It's my pleasure, and you're right. Very important topic, as we just talked about before we went on camera here. So few people, even after all these years that I've been trying to alert the public about the connection between poor oral health and gut issues, there's a lot of work that still has to be done because a lot of people just simply haven't heard this information. So thank you very much for having me on.
Well, you're welcome. And as we've discussed, this is a timely topic, and it's also a topic that's very personal to me. I come from a long lineage of dentists in my family, and my father was one of he was biologically trained in the end, but he was a rarity at the time. And we're going to explain what that means. But I have my grandfather was a dentist, my great uncle was a dentist, and they were all looking at me to become a dentist. Obviously, I'm not a dentist, but we have a lot to discuss and unpack on how this can be really helpful for not only our gut health, our oral microbiome and beyond, but many other aspects of health. So lead us into this. What got you interested in the oral gut health connection?
Right. Well, I mean, it was a long time ago, many years at this point, that we were basically like most people. My wife and I had gone to conventionally trained dentists. We thought we had people that we liked, we got along with, and got presented, the things that had to be done. But there was so much they never looked at. And so, long story short, my wife in particular, we had to unwind out of a lot of poor care. It's not something about blaming them. We're past that point, now, but they just didn't find infections that were there. They would literally put fillings over infected areas. And so we knew this later on, years later, uncovering all of this and getting all the dental work done. But because of all this, that's when I decided to do the Holistic Oral Health Summit. .com. You can find it there with a lot of biological dentists. And, over the years, all the programs I've done, I often say it's well over 500. It's probably closer to 1,000 at this point. I've been doing this in the health and fitness industry for about 35 plus years. And when I kept talking to these experts in holistic health, especially biological dentistry, it really started to get to me. And I had to look into it more and more. So I did a whole program. My wife and I did a lot of other changes. We are now with biological dentists, which essentially, for simplistic way of looking at it, is basically dealing with a dentist who understands that what they're looking at in your mouth is simply representative of the rest of your body. Makes perfect sense now to anybody listening. I'm sure they can appreciate what I'm saying. If you have gum disease, for example, weak tissues that are bleeding, the cellular integrity is down inside the mouth. Well, certainly that's going to be representative of compromised cellular integrity. And of course, the cells make up the rest of our body. So our circulation, our blood, whether it gets toxic or not, all of this is affected by toxins in the mouth and a lack of cellular integrity. And so our gut as well can get weak. And I'm sure you've talked a lot about leaky gut syndrome. A lot of people understand this term by now in terms of the gut being weaker, the walls, keeping stuff that we don't want to get into our body away from the rest of our body, keeping it within our digestive system. That's good digestive integrity, good cellular integrity. And so when our mouths are toxic, we've got heavy metals, we've got gum disease, we've got infected root canal treated teeth, even cavitations, which we can talk about, not cavities, but cavitations. All of this puts a tremendous strain on the rest of the body, the immune system, and of course, our blood and all the cells in our body, especially in the gut. Because another thing that I never even really thought about before looking into this with biological dentists was the simple truth that our gut health begins in our mouth, right? In school, you learn, oh, esophagus, stomach, small intestines, large intestines. Okay, great. But you don't really talk with what's going on inside the mouth, except, oh, yes, chew your food and saliva mixes with your food and it helps you with digestion. And that's pretty much like what most people might be exposed to. But there's so much more to it than that. And when we take better care of our mouth, our gut is going to feel better. And of course, the rest of our life as well. So I hope that kind of gives you a little background as to where I was coming from.
Oh, I love it. Yeah, and I have so many questions, and we're going to dive into it here. But one of the first things, and I think a topic that we hear a lot about, not only from our mouth and our dental health, but is the discussion of heavy metals. And one of the biggest sources of that comes from fillings in our teeth. Now, can you break down the difference between the types of fillings, and the ones that are the most notorious are these silver fillings? Why are these so bad?
Right, we'll keep it simple. I'm sure there are gonna be a lot of people who maybe even if they're watching right now, "Oh, come on, I already know what he's gonna say." Mercury-based silver fillings, which is 50% mercury in this, lead in this, nickel and other metals in there that have no really good biological reason to be in our body, but that's just the way these fillings are. A lot of people out there might say, "Okay, I already know this," but remember, the reason why I come onto these programs and talk about this so much over the years is because I am sure you know somebody with those dark fillings in their mouth right now, and they have no idea how toxic they are. You see, if you search on the internet for these kinds of fillings, for the most part, they're going to say that there are these hard fillings, these materials that they put inside of a hole in a tooth, right? You get a cavity, you've got a little pain, you run to the dentist, they drill and fill it with a mercury based silver filling. And the conventional wisdom, and I use that in quotes, is that these are hard materials and they're very inexpensive and they don't leak any of those substances. Well, that's completely not true.
Mhm.
And things are changing, but they're changing very slowly in terms of awareness out there. They absolutely do leak neurotoxic mercury vapors. They're escaping those fillings and mixing with your saliva, and you're swallowing that all the time on a daily basis, small amounts, polluting the gut. And of course, as I said before, making your blood more toxic, making it more difficult for your immune system to do the business of what we want it to do ultimately, which is to kill off unwanted pathogens, obviously to look for cancerous type cells and isolate them and escort them out of the body. We want our immune system to really take care of the big things. But when we're constantly stressed, physically, emotionally, mentally, people understand that. But certainly on a physical level, with the toxicity of these metals inside the mouth, it's really a dangerous thing. Now, what's the alternative? The other alternative is a plastic, yes, far less of a problem. These biocompatible, composite fillings that they can put in there, very white in complexion, really nice looking, no big deal at all. And absolutely, if anybody out there is dealing with issues with their brain function,
Mhm.
trouble concentrating, they just know. I don't think I have to explain that too much, that something is off about my brain function, my energy level, which is really where it all begins. My overall energy is a real problem. I'm sleeping in bed. I know I'm out like a light for hours, but I wake up during the day and I just don't have it anymore. If you're dealing with chronic fatigue, which is the first sign of any kind of serious health problem, you've got gut issues of any kind, and like I said, brain dysfunction, heart concerns, or certainly any kind of cancer concerns, I
Mm,
strongly urge you to connect with a biological dentist. You can't obviously do this yourself. And we can talk about some of the steps that are needed before and during the procedure and afterwards. But the idea is to get those mercury based silver fillings out as soon as possible. Put in those plastics materials, those composite fillings, get those in as soon as you can. It'll be so much better. Keep in mind, and I've told the story many times, one, two, three, and four, all four quadrants of my mouth, the lower and the uppers. I had 14 of these amalgam fillings, these mercury based silver fillings in my mouth. And I cannot tell you how good it felt. I had 4 visits for each of those quadrants, one quadrant a day. After that fourth visit, I felt so emotionally and mentally relieved. And the
mm,
big driver for me was my father, of blessed memory. He passed away from Alzheimer's. At the end, he had no idea anybody in his family, including his wife, my mother, and it was not a pretty thing to witness. And so, thinking about brain function and this toxicity that I know that these mercury-based silver fillings leach out, it was a big motivation, to say the least, to get those out. So I would encourage anybody really concerned about their health, they should go ahead and do it. And if they want to find a good biological dentist, the International Academy of Oral Medicine and Toxicology, so that's IAOMT, you'll be able to find a dentist that is a biological dentist. But again, it's not a guarantee. I always say this as well. Call around. You may have to travel, but make some phone calls and talk to the offices. You can tell if somebody's resonating with you or not. And
mm.
so that's what I ultimately encourage people to do, is find that right biological dentist for you that you feel can really be somebody that you can talk to and work with. They're part of your team. Let's face it.
Oh, absolutely. We have 3 or 4 that we work with, and we'll give our patients 3 or 4 names and say, go out, interview them, see who's the best fit for you, but know that they are biologically trained. One thing to note on those fillings, and I'm glad you've really gone into depth. Thank you, Jonathan, is that one of the objections I've gotten in the past is, well, doc, my fillings, they're 25 years old. I'm sure they're out of mercury by now. That's one of the biggest myths. They are still off gassing. And the more you chew and the more hot liquid you pour in there, the more they off gas. So that's still something. If they're old, get them looked at and get them removed. Now, how do we do that? How do we safely get these removed?
So we're talking about gut issues in particular, and I just want to, obviously, if you're very healthy, like I should say, I felt like I was, no real big problems that I could tell you about that I had, except my concerns about my future. I just went ahead and made sure I kept up with what I was doing. If you're not doing the things that I'm about to mention, I would really encourage you to make sure that you get these things in order, unless you're talking about stage 4 cancer, right? And I
Mm,
could go on for an hour about stories of people that just went in and got it done because the alternative was they really didn't have time to wait. But for all the other people out there who want to do this without any kind of real problem, the way to reduce your risk is, number one, make sure you're having at least one bowel movement every day. And that may seem like a strange thing, but the point is, you want to make sure your detoxification pathways are working well. Drink clean water, make sure those bowel movements are going, fibrous food, make sure you're eating that way as well. As much organic, and I'll be very specific, antioxidant rich food that you can. I personally like vitamin C. I use the powder every day. I have no health concerns except the stress of everyday life. Antioxidants are so important to, sort of the way I put it, be that buffer in between the stresses that you experience every day and good health. So the more antioxidants you have on board, the better. I have green powder drinks in the morning. I'm doing my smoothies with superfoods. Everybody's got to find their way to eating healthier organic food, at least I would say several weeks to months before you're going to start the extraction process. So I
mm.
think you get the idea with that. And of course, a biological dentist, a good one, can help you with that. A good health coach, a naturopath, you get the idea. Just talk to someone about how to get your life in order so everything is as nutritious and as built up as possible. Now, in terms of the extraction process, you want to make sure that that dentist is protecting themselves and you as much as possible. I was in basically an ICU unit of the dental office. The door was sealed, then well ventilated inside, separate from all other rooms. A lot of dental offices don't really have this kind of setup, but it really showed me that my dentist was on his game. He knew exactly what he was doing. There's also a huge suction tube that should be placed underneath your mouth to really draw any kind of vapors as quickly as possible away from you. In terms of before they even start doing the drilling, there's a charcoal rinse. Doesn't look pretty. I wouldn't take a picture of yourself smiling right after rinsing with it. But the idea is to rinse with this charcoal liquid, right? And then swallow it. So it's coating your esophagus and your whole digestive system. For anything that might get in there, it's going to be those poisons, those toxins are going to attract themselves to the charcoal, and you're going to be more likely to eliminate them. So, in extracting as well, I was fortunate. You have to make sure that your dentist appreciates this. And you can obviously talk to them about it. Getting out as much of the filling as possible when they're drilling in one shot. Because obviously, the more they have to break these pieces apart, the more of a risk it is. I was fortunate. My fillings were kind of shallow and it was like zip, zip, zip. And it just sort of popped them right out in a whole piece. So it was really good for all the fillings that I had. And again, you just have to get with a dentist who's really got good hands. And that's why it's important to take your time to figure this out. And, if you can, get a good recommendation. Um, I would say other than that, obviously they're protecting themselves with a mask. They're ventilating the whole room as well. The hygienist is going to be protected. You're going to have a full garment on to protect yourself and your clothing and have oxygen, but preferably attached to your nose so that you could be breathing in oxygen while this is all going on. It's really great. And again, load up on that vitamin C beforehand and even afterwards as well. This is a major thing you're having done. So load up on that vitamin C because all of that is really good. Keep in mind, our adrenal glands are so responsible for producing the vitamin C or needing the vitamin C, I should say, that we need when we're under a lot of stress. So anyone out there who feels like they're under a lot of stress, they're going through a procedure like this, afterwards, your body is going to welcome that vitamin C or any antioxidants you can give it and soak it right up in the tissues. And it's really going to sort of mitigate and reduce those risks that you might experience where so oftentimes people will, as a very simple symptom, feel so exhausted, right? So obviously get all of that on board. And of course, don't schedule the busiest week of your life after something like this is done. So I hope those tips help. But obviously, a good biological dentist will walk you through a lot of this.
Yeah, those are huge. Thank you, Jonathan. And one of the things that we've done with our patients on the note of vitamin C is that we do it orally, but we also give them an infusion or two right after their treatments. And you can get a much higher dose that way that can act as a bit more of a binder and a gentle chelator just to remove anything that might have been mobilized during the procedure, whether you inhaled it or not. But a good biological dentist will really minimize any of that exposure. Let's talk a little bit about, I want to move to gum disease because I know you've got a ton of information for us and why this is important. And more importantly, what are some of the hidden causes of this gum disease? Where is it coming from?
Well, I know we're limited on time, so I'll try to be brief and to the point. But, with gum disease in general, I think it's a lot of lack of at home oral care. We can talk about that, but certainly a lot of sugary foods. And I'm talking even to the people out there who eat organic, sugary treats, pasta, bagels, cookies, crackers, all of this. Please don't shoot the messenger. But a lot of this sugar based eating definitely will go a long way to weakening your tissues of your body. So if you can cut that down to a minimum, that's really helpful. In terms of other causes, Stress can easily do that, mental and emotional stresses. There are infections that we can have, but all of this that we put into one bucket really still comes down to what can I do to boost myself up, keep my mouth as clean as possible. And I think when it comes to that, we need to obviously brush away from the gum line. When we're brushing our teeth from the bottom, we're brushing from the bottom up and away from our gums. From the top of teeth, it's from the top where our gum is. We brush away from the gum line. It's a simple technique that's really smart for brushing teeth. Flossing is great, certainly not the end all by any means in terms of reducing your risk of gum disease. But I will tell you, there is one big thing if you have gum disease, and we can talk about how you can find that out as well. I'm happy to do that. But if you do have gum disease, which is as simple as when you brush and you spit out, if there's blood in the sink, that's gum disease. Now, gum disease is a spectrum, right? You can have very mild, or it could be, massively gross where you can really see it in your mouth. Obviously, there's a lot in between as well. But if you see a little bit of blood, even when you're brushing, that is really a sign that you have to take better care of your teeth. And I would say for all of those people, and even those that want to prevent it, obviously you don't have to do it as much, but on a weekly basis, and for those with full blown gum disease, it's going to probably be 2 or 3 times a day. You're going to want to take a bucket of water in a hydrofloss unit. That's really just, that water is shooting into the gum line area and it's getting into places where a brush won't and flossing simply won't as well. So both of those are great, brushing and flossing, but definitely do the hydrofloss. Oil pulling is fine. You can incorporate that into your week as well. I wouldn't go crazy with it from all the biological dentists I've spoken to. It's a good thing to keep the oral cavity, if you will, nice and healthy. 5, 10 minutes at the most of swishing around, depending on the severity of your mouth conditions. You may do it once a day or just a few times a week, but just, an oil like coconut oil and swish it around. And when you spit it out, make sure you spit it out into a garbage pail. Don't spit it out into your plumbing of your sink because it'll muck it up and you'll have more problems than you want. So there's that. And also there's essential oils as well: neem, clove, peppermint. I have a blended formula, if you will, of essential oils, and just a drop on the finger and just kind of rubbing it onto the gums on the bottom and the top, on the outer part and on the inside. Maybe take another drop and do the whole inside. Mouth feels really fresh, and it's just a really healthy thing to do. So these are some of the things. Certainly, if there's a little bit of pain issues, an interesting thing about gum disease is it can be very deceiving, even for the wrong kind of dentist that you're talking to, where you're complaining about your tooth is bothering you, like nerve sensations, or you could swear, oh no, I got to pull this tooth, when really it's a gum issue, the gum tissue. And if you could just reduce the swelling by the things that we've already talked about: healthier, fresh, organic food, lots of antioxidants, load them up supplemental wise, vitamin C powder, your green powders, your superfood powders, all of this. But also just keep in mind that this gum inflammation, if you want to knock it down fast, just a sea salt water rinse. Just put some sea salt in water, stir it around, and just start swishing and let that just soak into all those tissues. You might, within a day or so, and I've heard this many, many times over the years, wow, pain is gone. So that really shows you that it's a tissue inflammation thing. And the good thing about that is you just don't feel that tremendous anxiety anymore. You don't feel like you have to rush to the dentist and yank out a tooth. And it really gets you thinking about how, wait a minute, maybe I really do have to cut down on my sugary food. I've got to make this eating a little bit more healthy and getting on top of my game. Take this a little bit more seriously and then start incorporating a lot of the things I mentioned you can do at home. on a more regular basis. And, you know, thank God I've been doing this for years and it's pretty darn good. And I'd also throw in one other thing. When you're with a good biological dentist, if you've got a full blown case of gum disease, a great way to do checkups is to go to that dentist once a quarter. So every 3 months, go and check your gum pockets. And I don't know if you want me to go there, but that's a whole other big issue. Not to call out any names, but there are a lot of biological dentists who have great hearts, but their dental hygienists really could use a little bit more training. The whole office protocol should go way up. Conventional dentists, forget about it. None of them are doing it. Taking a little probe and checking your gum pocket size
Hmm.
for each and every tooth. It's a very simple thing that just takes a few minutes to let you know what your number is for each and every tooth. And when you hear those numbers read out, it's actually 3 points in the front, 3 points in the back. And you can hear those numbers as they go along in your mouth. You want to hear a 1, 2, 3. You start hearing 4 and 5 and 6. And most importantly, as you go through the visits with your dentist, if you notice that those numbers are going up and up, you really have to start honing in on that area to knock down that size of the gum pocket, because obviously a larger gum pocket is going to give that ability for those unwanted buggies, if you will, to get into the rest of your body. So really tight gums, 1, 2, or 3 on that gum probe that they stick into your gum there. Make sure that your measurement is only a 1, 2, 3. You're doing okay if that's the case.
That's great. Thank you. One other thing that I wanted to ask you, Jonathan, on gum disease is we're seeing in the research some connections to some of the chronic diseases that are out there coming all the way back to proper oral health. And I know there's a few other components to that, but even with gum disease right now, are you seeing any connections with, a very advanced form of gum disease and risk factors for other types of chronic disease?
Yeah, I would venture to say that for all the chronic diseases that most people are suffering with, absolutely. Conventional literature certainly says that the gum bacteria, the nasty buggies that are in our mouth in general, do tend to have an affinity. They seem to be attracted to the heart muscle itself. So, cardiovascular disease, that's a biggie. And that's not woo woo science, that's conventional. But certainly, the other things that I've already said that are important for people to remember is any kind of gum disease is a real problem with cellular inflammation. Cellular inflammation and a lack of cellular integrity, that healthy wall and that real healthy response of being able to bring in really great amount of nutrients, get those wastes out for the cell to function in a very healthy way. All of that needs to happen for us to feel well.
Mhm.
That means sleeping well at night, having lots of great energy during the day, and not having to deal with hypertension connected to cardiovascular disease, cancer cells that rapidly replicate out of control. All of this, its foundations are in cellular inflammation. So it's really common sense. And it's why I really appreciate you allowing me to talk about this one particular topic, because as I often say, I know a lot of people watching this. I get it, Jonathan. Organic food, exercise, meditation, have great relationships with people, but the bottom line is if you're ignoring this real physical problem, stress that is pinging you every single day of the week,
Mhm.
a lot of times it's going to be a problem for a lot of people. And so, and just and along the lines of blood toxicity, it's another simple way of looking at it. With disease in the mouth and toxins in the mouth pouring into the rest of the body, your blood is where it's at. So if the blood is toxic, it's bathing every cell. That's where the cells are getting inflamed. And that's where we see all of this dysfunction,
Mhm.
toxic thyroid, overstressed out adrenals, hormonal imbalances as well. A lot of this stems from toxicity, and then the inflammation that occurs. But so often, even in integrative medicine, functional medicine, no offense to your practice, I know you practice it in a really smart way, but in a lot of cases, the mouth is overlooked. So
Mhm.
that's why it's really important part of an overall plan to stay well.
That's why we have you on this summit today, Jonathan. We need to educate the masses on the importance of this. We have microbiomes all over our body. We have a microbiome in our mouth. We have a microbiome in our gut. We have many other systems. Now, this leads me to another big topic that I want to dive into. What's going on with cavitations? You alluded to this at the beginning. Let's break it down. Tell us all about what we need to know there.
Well, with this one, it can be a bit tricky, and obviously you're going to have to get with a very good biological dentist. But in a nutshell, you're talking about bone infections, and a lot of these are coming, not all the time, from improperly extracted teeth. So, as one big example, oh, that wisdom tooth is there, and whenever you did it, let's yank it out, but the ligament remains. What happens is it doesn't really heal so well. And then you have this pocket of infection that occurs. Now, a lot of times with a cavitation, the tricky part is you may not have any pain at all. You have no idea. And you go to a dentist even, and they do those bite wing x-rays. Nothing really is coming up. And so you go in and you go out, and this goes on for years. The cavitation, the bone infection that's happening there is being walled off in a lot of cases. Sometimes not so well, in many cases. Sometimes you could be fortunate and it's really walled off well by the body, right? It actually builds this sort of barrier, if you will. And you can see this, an indication of it, with a well trained biological dentist who has an experienced eye with a cone beam x rays, three-dimensional type x ray, where you can maybe get a sense, oh boy, something's going on here in the bottom right, the upper right, one area of the body. Something doesn't look right below the gum line. But if that dentist still suspects, you can't really fully know until you cut the gum and go in there. And that's when you see this mushy bone, if you will, this infected, like rotted type material that really the only way is to get in there and just sort of drill until you get to a harder bone. And hopefully you can, and you get it soon enough that you can just clean out that area. All of this is a big deal because ignoring these cavitations for too long, it's constantly a stress on the immune system. Remember what I said to you before, it's not just cavitations, but it's all these aspects of what might be not so great happening in your mouth that are constantly telling your immune system, hey, we've got a problem here. Pay attention, deploy resources. Let's go. But it's draining the energy of the immune system, if you will, sort of painting that picture for you, where it now won't necessarily detect those cancerous cells. And therein lies the problem, right? So that is why all of this, not something to get stressed out about, but to get super motivated about why should I do all these things? Because it's fun, because we enjoy living a healthy life. We want to live a healthy life. So we want to get rid of all these things that can distract our immune system from what we want it to do the most, and then enjoy our days all the years of our life. So for me, it's not something that I ever say all these things to put more stress on people. Whatever I've gone over with you today, or any of the other presentations that you ever listened to on this program or any other program, what resonates with you? What's hitting you hard?
Mm.
What do you know for sure you need to do right now? Take care of it. And if you're kind of not too sure, but you just feel like biological dentistry, I need to find one, then just go do it. And I'll use a pun, I guess, on purpose, right? Follow your gut. Your gut intuition is rarely off. And I'm being kind about that. I mean, I personally feel like when something hits you, just go with it. Okay. And don't be so self conscious. Don't worry about what other people think. If you really feel like something is important, it's your life, it's your health. I would encourage you to just go for it and take care of that first thing on your list. Soon as you get it off your list, there'll be something else that rises to the top. And it's what I've done for over 35 years. And all I can say is it feels like the right way to do things.
Powerful. Thank you. What are some other home care tips we can do starting today to improve our oral health?
Well, I think we covered it, but just to recap, I mean, certainly the brushing is important each day. And again, especially if eating those sugary things that we like to enjoy, even those organic food snack bars or whatever it is that you might like to enjoy, brush right afterwards, right?
Mhm.
And, there's herbal toothpaste. Obviously, stay away from the fluoride products. There's no need for that. These mouthwashes, these conventional mouthwashes, just avoid all the obvious chemicals as much as possible, always in your life. Brushing, the flossing, don't get a floss also, obviously, that's waxed or has some stuff on it. Conventional, they make just a simple string that you can just sort of guide in and out between the teeth. Hydroflossing, I cannot stress enough how important that is. Again, if you have gum disease, you may want to hydrofloss a whole bucket of water and shoot it around all the gums. Depending on the gum disease that you have, the size of your gum pockets, you may have to get different tips that you use at the end of that hydrofloss device so that when it's shooting the water into the gum line, it's not just sort of a big opening, a generalized tip, if you will, but more these specialized tips with a more narrow focus of that stream, right? So
Mhm.
that's something you have to go over with the dentist to make sure you're using the right tip for your particular situation. But keep in mind, what's nice about this right away is you could be gushing blood out of your mouth by hydroflossing the first time. But the second bucket or the third bucket that you do right away afterwards, you might see that that goes down. And that's a good thing. And then over the days that you do it, a very short time, you'll notice that the bleeding goes way down to next to nothing. And in fact, in many cases, can disappear. And the idea is to keep this up to reduce those gum pockets. That's the biggest deal. You must know that you can reverse these gum pockets and you absolutely naturally, depending on how severe it is, but in many cases, you can really reverse that gum disease. And another thing to keep in mind is the gum pockets themselves might be large, but if they don't bleed, you're going to be okay if you're doing all this maintenance, right? So, again, there's a lot of in between that you need to figure out with your own dentist, but that's a biggie. Sea salt, like I said, in water for saltwater rinsing is great. The essential oils that I said that you want to use is just putting it on your finger and then just rubbing it onto your gums as well. I would say all of that is really great. Another general healthy thing for you to do, which starts in the mouth, and I always like to throw this in as much as possible, is not so much how to take care of the gum tissue as it is to utilize your mouth as a chewing machine.
Mhm.
Slow down a little bit more and chew any of your food, hopefully as healthy as possible, much more than you're used to. That will go a long way to reducing the stress in your gut, to improving the chance of that food to be broken down and to extract the nutrients from the food. So chewing food is just really good as well. And, again, hydration is great. Clean water is really important. Obviously, don't drink the sodas that are out there that are just super toxic with sugar and all kinds of or artificial sweeteners. It's the absolute worst. So again, I'm meeting a lot of people. We spoke about this before being on camera. I'm a pickleball player now, and I can't tell you how many people are drinking Gatorade, chewing gum, and putting stuff in their mouth that's artificially sweetened. And honestly, with a lot of compassion, once I get to know them and friendly and I talk to them a little bit, most every single one of them has no idea about any of this and how toxic it can be for the rest of the body. So again, thank you very much for having me on. I really appreciate this.
Jonathan, as always, this has been incredibly insightful. You and I have done many of these over the years, and I'm always just in awe of your passion, your knowledge, and your commitment to the betterment of everyone's health out there. So, thank you for taking the time out of your busy schedule and being on here today. Where can we find you again online if we want to get more information about you and your services?
Very simple. They can go to one word, Natural Health 365 programs.com. And that's programs plural with an S at the end. Natural Health 365 programs.com. And thanks again. I really respect all of your work. We've known each other for many years and you're doing a great job. And thank you again.
Thank you as well. Have a great day, Jonathan.